Bonjour à tous. Good morning to all. My name is Martine Lagacé. I'm the Associate Vice President, Research, Promotion and Development at the University of Ottawa. It is my pleasure to welcome you this morning to this session that will be dedicated to the new Interdisciplinary Center on Black Health, the Centre Interdisciplinaire pour la Santé des Noirs, recently created at the University of Ottawa. Black communities in Canada face many inequalities with direct and indirect impacts on their health, the care they access and receive, and their right to make decisions concerning their health and care. Although health disparities faced by Black communities are well documented in the US, there is an egregious lack of knowledge and data to support the generation of racially informed approaches to population health, healthcare, and health professional training in Canada. The gaps in research, care, training, and public health policies motivated the creation of the Interdisciplinary Center for Black Health at the University of Ottawa. It will be presented during this virtual room this morning. So over the next half hour, we will be hearing from the founder and director of the center, Dr. Jude-Marie Sena, as well as Dr. Chibuike Udenigwe, a member of the center. The Interdisciplinary Center on Black Health is the first research center dedicated to studying the biological, social, cultural, and economic determinants of health in Canada's Black communities. The center was inaugurated a few months ago and aims to bring together in one teaching and research space scholars with complementary expertise in medicine, sociology, psychology, nursing, nutrition, law, epidemiology, and economics who will work in synergy to promote health equity for members of Black communities and encourage a preventive approach. Before introducing Dr. Sena and Dr. Udenigwe, I would like to remind you that this session will be held in both French and English, so feel free to ask your questions in either French or English using the Q&A function. We will have about 10 minutes after the end of this conversation with my colleagues for you to ask some questions, provide comments and suggestions. Let me now introduce our two guests, Dr. Jude-Marie Sena, who's an associate professor in the School of Psychology and the director of the Vulnerability, Trauma, Resilience, and Culture, a research laboratory at the University of Ottawa. He is the director of the newly created Interdisciplinary Center for Black Health. His research program explores factors associated with vulnerability, trauma, and resilience, with a particular interest in the role of cultural factors. Dr. Sena conducts research on racial disparities in mental health and social services, the impact of natural disasters and infectious disease outbreaks on mental health, interpersonal and non-interpersonal trauma, and global mental health in North America, Europe, Africa, and the Caribbean. During the pandemic, he published a psychological intervention guide, Intervening in the Context of Infectious Disease Outbreaks, a guide to help dealing with the effects of the silent mental health crisis. Dr. Jude-Marie Sena leads a major project on the mental health of Black communities in Canada that has allowed for the development trainings to equip mental health professionals with the knowledge to provide culturally appropriate and anti-racist care. Dr. Sena is also a fellow of the Royal Society of Canada. Dr. Sena, bonjour à vous et bienvenue ce matin. Dr. Chibuike Udenigwe is a professor and university research chair in food properties and nutrient bioavailability at the School of Nutrition Sciences at the University of Ottawa. He holds a cross-appointment at the Department of Chemistry and Biomolecular Sciences and is a faculty affiliate at the Institute for Science, Society, and Policy at the University of Ottawa. He specializes in food biochemistry, and his research takes the chemical sciences approach in exploring food, nutrition, and health with a focus on sustainable processing, functional foods, and nutraceuticals and their beneficial effects on metabolic and mental health. Dr. Udenigwe was a Carnegie African Diaspora Fellow and is a member of the prestigious Global Young Academy. Dr. Udenigwe, welcome.
Thank you.
Ma première question, donc, ce matin, ira au Dr. Jude-Marie Sena, donc, qui a fondé ce tout nouveau centre de recherche interdisciplinaire pour la santé des personnes noires. Docteur Sena, ma première question est bien simple. J'ai parlé brièvement de ce qu'est ce centre-là, mais j'aimerais vous entendre comme directeur, comme la personne qui a pensé ce centre-là, le pourquoi de ce centre-là et aussi son positionnement dans le monde de la recherche et certainement dans le monde des politiques publiques aussi.
Hier encore, j'étais en réunion avec Statistique Canada et on discutait du manque de données qu'il y a pour cerner la santé des communautés noires. Peu importe l'enquête que vous prenez, c'est une représentation globale des personnes noires. La représentativité, elle est faite sur la base du Canada et puis après, les communautés noires sont vues comme un bloc monolithique. C'est comme si c'était un groupe de personnes, c'était la même chose. Pourtant, quand on va regarder dans les données, on va se rendre compte, par exemple, entre ceux qui sont nés au Canada et ceux qui sont nés ailleurs, il y a de grandes différences. Déjà en termes de santé, déjà en termes de compréhension, de littératie de la santé. Quand on regarde aussi par rapport à la santé mentale, on va voir de grandes différences. Si on prend, par exemple, les communautés qui sont au Canada depuis 4-5 générations, les difficultés de santé ne sont pas les mêmes comparativement à ceux, par exemple, qui sont au Canada, qui sont des immigrants, par exemple, ou ceux qui sont de la deuxième génération. Donc, on a compris que quand on parle des Noirs au Canada, ce n'est pas un groupe monolithique, c'est un groupe avec différents facteurs de risque, différents facteurs de protection qu'il fallait comprendre. Mais aussi, on a compris qu'il y avait des problèmes de santé qui étaient plus communs chez les personnes issues des communautés noires. Par exemple, la question du diabète, la question de l'hypertension artérielle, certains types de cancers également. Et puis, nos études nous ont montré que ceux qui vont être victimes de discrimination dans le milieu de santé, ils vont moins fréquenter le milieu de la santé. Et quand on parle de ceux qui vont être victimes, dans nos enquêtes, c'est 53,1% des personnes issues des communautés noires qui vont dire qu'ils vont être victimes de discrimination raciale majeure dans les services de santé. Donc, on parle de la majorité d'entre eux. Et c'est peut-être pour ça, je dis peut-être, parce qu'aujourd'hui encore, nous n'avons pas les données que des femmes qui vont présenter certains signes de cancer du sein vont consulter beaucoup plus tard et vont être prises en charge beaucoup plus tard. Et même quand elles vont consulter, elles vont être quand même prises en charge beaucoup plus tard que d'autres femmes. Alors, nous, on cherche à comprendre tout ça et c'est pas juste pour être à la mode, ce centre. Ça répond à un réel besoin de comprendre. Hier encore, je regardais les graphes de Statistique Canada par rapport à la mortalité. Les personnes issues des communautés noires, ils meurent plus jeunes, ils sont plus nombreux à mourir plus jeunes et quand on regarde l'espérance de vie, eh bien, ce n'est pas la même espérance de vie par rapport à la population générale. Donc, tout cela nous amène à comprendre qu'on parle d'une chose qui est crucial si on veut que les communautés noires aient l'impact qu'elles doivent avoir sur l'économie canadienne, parce que quand on en parle, ce n'est pas seulement pour les communautés noires, c'est aussi pour l'économie canadienne, c'est aussi pour la santé du Canada d'avoir des communautés noires en santé et ce centre-là va servir à ça, de nous procurer les bonnes données, les vraies données et de nous permettre de pouvoir développer des formations pour que ces personnes-là soient mieux prises en charge, mais également de meilleures politiques publiques en ce qui les concerne.
Merci beaucoup, Dr. Sena. I'm going to turn to Dr. Udenigwe. So your colleague was mentioning the importance of generating and collecting data in order to inform, for example, public policy decision making, and actually probably to avoid the stereotypical visions that we have of minority groups, for example. How does that relate to your own research, Dr. Udenigwe?
Thank you for that question. I agree with my colleagues' statements because particularly looking at it from the nutrition point of view, you would see that there are a lot of diet-related health issues, for instance. And if you look within the Black communities, you observe sometimes a very high prevalence of these diet-related diseases, say compared to the rest of the population. For instance, when you talk about hypertension, and type 2 diabetes, you see that there are increased prevalence within the Black community of these diseases, and they are tied to nutrition and lifestyle. And if you look at the general approach towards mitigating some of these diseases, sometimes it doesn't take into consideration this big statistical difference within the Black community compared to the rest of the population. So that brings this center, that makes this center even more relevant, because then with focusing on the specific data related to the Black communities, you'll be able to distinguish and separate and hopefully find some of the primary causes and also mitigating factors that could be used to influence policy and effectively address some of these health issues.
Je reviens, Dr. Sena, à cette question parce qu'elle est cruciale. Vous avez mentionné au début, du côté de nos collègues américains, il y a davantage de données qui existent. Pourquoi ce point aveugle au Canada sur les communautés noires et les questions de santé?
Parce que nous avons toujours utilisé un colorblind approach au Canada. Et c'est pas seulement en santé, ça traverse toute la société. Et comme je l'ai dit c'est la semaine passée à une conférence à McGill, when people say, oh, I don't see your skin color, I see you as a human being, you are a human being, and it's okay for me, you are a human as other human beings, and it's okay. So I can say to them, please see my skin color, because my skin color can be part of my problem. And sometimes it is a problem because you experienced racial discrimination and you experienced racial trauma. And we have to understand, we have to I think to avoid the colorblind approach. And in the US, ce qui s'est passé pendant les 30-40 dernières années, c'est qu'ils ont pu vraiment recueillir beaucoup de données qui ont permis de mettre en place un ensemble de programmes, et je pense que ce soit à l'Université de Johns Hopkins, mais aussi on peut permettre d'avoir des politiques de santé publique pour essayer justement de réduire, en fait, en termes de prévention, en termes d'intervention, et de permettre de mieux outiller, par exemple, les étudiants, de mieux outiller les professionnels de la santé, et également de mettre en place un ensemble de programmes de prévention pouvant permettre de... Je prends cet exemple, par exemple, sur la question du cancer du prostate, par exemple. Les hommes des communautés noires en vivent plus. Et pourquoi ils en vivent plus? Pourquoi? Et puis, on va se rendre compte aux États-Unis, on ne sait pas pour le Canada, mais aux États-Unis, par exemple, juste le fait de diagnostiquer plus tôt et qu'il y ait un suivi, que les tests soient faits dans plusieurs communautés, juste ça fait réduire non seulement le nombre de cancers, mais également, ça fait réduire également, ça permet une meilleure prise en charge, une prise en charge beaucoup plus tôt de ce problème-là et de pouvoir le résoudre. Au Canada, notre approche basée sur le fait d'être aveugle sur la question de couleur, le fait de je ne vois pas la couleur de la peau de la personne, c'est une approche en fait raciste, parce que plus on ignore la couleur de la peau de la personne, ben, plus on peut être en train de perpétuer des discriminations qui existent parce que justement, on ne veut pas voir toute la question, toute l'amplitude de la question. L'amplitude de la question, c'est « OK, je présente un problème d'hypertension artérielle parce que j'ai été victime de discrimination raciale ou peut-être parce que je mange de telle manière dans ma communauté. » Donc, il y a un ensemble de choses à aller chercher, et ces facteurs culturels, ces facteurs sociaux, ces facteurs biologiques, on doit en tenir compte si on veut pouvoir prendre en charge de manière appropriée, de manière culturellement appropriée les personnes issues des communautés noires.
Merci beaucoup. Dr. Odenigwe, the center will be focusing on health of Black communities, but health as defined in its generic approach. So physical, social determinants of health, psychological, and so on, right?
Yeah, absolutely.
Could you expand a little bit on this?
Yes. So the center focus, as you put in the introduction, the center focuses on study of the health of the Black communities in Canada, and looking at it from a biological, social, and cultural determinants of health. And that is why this center is truly interdisciplinary, because we have membership from very different faculties, from the Faculty of Law, Faculty of Medicine, Faculty of Health Sciences, as well as Faculty of Social Sciences, looking at the problem from these different perspectives. And that helps because now with the center divided into 5 major axes, you will see that the different aspects of Black health of the Black communities, ranging from chronic diseases to infectious diseases and mental health and substance use, also population and public health, as well as child and adolescent health. So looking at it from all these 5 axes, we'll be able to tackle some of these issues from the root, but also help generate data that could help specifically inform policy in order to address the challenges that we face currently in the Black community.
Now, there are most probably high expectations for this center, as it is a first among Canadian universities. I presume that there is already strategic partnerships that are, if not envisioned, already established. Dr. Sena, est-ce qu'il y a déjà des partenariats d'établis avec soit, it could be with other universities or government partners? As this, this center is absolutely must, so that we must gather some information, some data, and so on to, as we said before, improve decision-making in terms of public policy. So I presume that government is really turning to you now.
Yeah, and we have a partnership already, and I think it is very important. We also have local partnerships. And I think that is important for our implementation because we are in the National Capital Region and we have partnerships with the institute, the research institutes affiliated to of that hospitals. And I think that part is important, but also with community health centers and community organizations. And we also have partnerships with different faculty, different universities across Canada. And we try to bring to the center expertise from different colleagues. I can maybe say McGill, University of Toronto, University of Alberta, University of Calgary, but also in Nova Scotia, in Manitoba, in British Columbia, because I think that part is very important for us. We also have partnerships with people from the US because we have to learn from them. But we also have to learn from their mistakes too. And we have to do more because what we want the center to be in the next 5 years is to be the leader in Black health in North America. In not just in Canada, because we also have to be that leader in North America, but also we found that center with a social accountability perspective, because what we will develop will serve people in Canada, people in North America, but also people from the Black communities across the world. We also have we are developing right now a partnership with the PHAC, the Public Health Agency of Canada. We also just have a funding from CIHR, and we will develop partnerships with other agencies and public health agencies across Canada, because our goal is to be able to provide enough data to them to be able to guide the politics, to guide the policies. So we will develop some other partnerships, but we already have partnerships with people, with researchers, but also public health agencies across Canada.
Now, in the short term, can you give us a few examples of research projects that you are currently working on? Soit Dr. Sena, Dr. Oudenigwe, pardon. Can you give us a few examples of research projects that you're currently, the center is currently driving?
Maybe I can start with our first project will be on vaccine within the Black communities. Right now, there's hesitancy on vaccine among the Black communities. It is a fact, but we don't know why. We don't know why people can. We have some assumptions. It is because racial discrimination, since history of racial discrimination, or the medication test among Black communities. But we have to know more. And This is why we put together people from community organizations, faith leaders. We worked on that project with pastors, priests, imams. We also work with other university, and we are going to start the collection of data in January, and maybe there will be an expansion of that project, because we are speaking with PHAC about that right now. This is our first project, but we also have project on mental health within the Black communities. It is different types of data collection, both quantitative and qualitative data, and we are speaking right now to have the first Black Canadian Community Health Survey, and we are planning right now the project, and that will be our, I think, big project for the next 5, 6, 10 years.
And on your side, Dr. Odenigwe, what kind of projects will you be working on, or are you currently working on through the center?
Well, I think Dr. Senat has covered majority of the center-led research projects, but I also know one of my colleagues, Dr. Itoa, is also working on HIV/AIDS as one of the infectious diseases focus within the Black community. So in addition to that, moving forward, from my disciplinary point of view, we hope to generate information with respect to the nutritional lifestyle and nutritional habits of people in within the Black community, and try to see how they affect their susceptibility to develop some of these major health issues related to diabetes, for instance, cardiovascular disease, and hypertension, which is really very prevalent within the Black community. So this is perhaps one of the major focuses, from my disciplinary perspective. And then working with the team members in the center, we can look at it not just from the nutritional point of view, but also from the social point of view, from the cultural point of view, in order to have a better understanding of how to change our dietary habits in order to positively influence our health, but also to generate information that could help guide decision making moving forward. Thank you.
Okay, thank you so much. I just want to remind participants that you can always use the live Q&A to ask your questions. And I'm going to take 1 minute to read one question for both of you, Dr. Sena and Dr. Odenigwe. So I understand the importance of data collection in informing health policy in order to urgently improve the health outcomes for Black Canadians. What can we do concurrently to break down the systemic barriers that lead to health inequities? Dr. Sena, Dr. Odenigwe, voulez-vous répondre à cette question? So what can we do concurrently to break down the systemic barriers that lead to health inequities / racism? It's a good question.
Yeah, it's a well good question, and I think first it is about to raise awareness on that within. I think in Canada, we have a lot of attitudes that hurt people from the Black communities, and I think I think when I say we as leaders, we are politicians also, they have to change. I think they have to change the mind on the Black communities, and they have to really think about policies for the Black communities. Let me just take an example. Something that hurt people from the Black communities across Canada today, and yesterday I read a lot about that yesterday night, and it is for example, that situation in Quebec. You have three adolescents were died, and for the white adolescent, there is a lot of the prime minister, the premier came and he got flowers for him. And you can see the double standard And I think when we show that to the communities, and it is for example, after that, I'm a nurse and I can see that double standard, and I learn to practice that double standard. I think what we can do is first raise awareness, second, have some training for health professionals. We can also, I think, we have also to state it is a problem. Like even we don't have enough. We don't know exactly what to do. We have to state it is a problem. I think in Ottawa, this is one of the things the Public Health Ottawa said. They know it is a problem, and they state it is a problem, and they said we are going to work on it. And I think it is the first thing, but also we have to train our health professionals. But I think the universities and colleges have also a role on that, because they are from our universities, they are from our college, and we continue to train them with a colorblind approach. I think we have to mobilize colleges, universities, but also the hospitals, the health services in general, to know they at first they have to state it as a problem, and then they have to raise awareness about racism, because I think without data we can stop racism within the healthcare system.
So acknowledging first is the first most important thing, and changing the social views and changing the discourse as well, which, because words are very, very, very powerful. Training, education. So ce sera en partie le devoir du centre-là d'essayer d'utiliser ces outils. We have just a few minutes left, and I would like to come back to the aspect of knowledge mobilization of this new center, which kind of relates to that question, actually. Correct me if I'm wrong, but ce nouveau centre interdisciplinaire pour la santé des Noirs aura une dimension importante en termes de mobilisation des connaissances. There will be a training component in addition to research, right? Yeah. Dr. Udenigwe, would you like to comment on that? The importance of the knowledge mobilization aspect of the center? Yeah.
I can briefly, and perhaps Dr. Senat would provide more details. Yes, knowledge mobilization is a very critical component of the center, and this is particularly unique. The center is particularly unique because of our strong connection to the Black community organizations and the Black community in Canada. So this would help, in translating knowledge directly to the community. Compared to the expected scientific communication. So having a very strong connection with the community builds trust, because sometimes it's the community needs to trust the people that they're dealing with in order to benefit from the center's activity. So I believe that connection is quite unique and important to help us translate information and disseminate research results within the community. So I will defer to Jude to provide maybe additional.
Yeah, thank you. I think we are going to develop. We developed a training and protocol on mental health, on how to provide anti-racist mental health care, and I think we need to continue to develop some guidelines, some protocols in, for example, how to provide anti-racist care for nurses, for health nurses, and for physicians, for example. Je pense que l'idée, c'est vraiment d'essayer de développer un ensemble de formations, mais de garder toujours ce contact-là avec à la fois les services de santé de manière générale, ceux qui fournissent des soins de santé, mais aussi de garder cette connexion avec les communautés, qu'on soit toujours enraciné dans les communautés, et que nos travaux puissent permettre à la fois qu'on puisse développer des éléments en termes de prévention, mais aussi en termes de soins, et c'est ce que nous allons faire.
Docteur Odenigwe, Docteur Sena, malheureusement, il nous reste 15 secondes. Je veux terminer. I want to end by congratulating you pour avoir été visionnaire dans la création de ce nouveau centre interdisciplinaire pour la santé des Noirs. All the best to the Interdisciplinary Center on Black Health at University of Ottawa. Thank you very much.
Thank you.